Do you or someone you know and love suffer from Parkinson's disease symptoms? According to the Parkinson's Disease Foundation, there are more than 10 million people around the world afflicted with Parkinson's disease. Many people have tried various medications like Cinnamon, like L-Dopa, Azilect. They're people who I've gotten to meet with. My name is Dr. Herman, and people who I've gotten to meet with or discuss with, and even watching a family member a couple of decades, or at least 15 or so years ago, I should say, who met an untimely early demise because the Parkinson's disease took his life and the medications did not work, and it was a rapid downward spiral with him and his condition. So I take this a bit personally. And watching other icons like Muhammad Ali not be able to exist anymore, who also did not benefit from the procedures, from the medications, from the protocols that certain groups are saying is going to be the cutting edge medication to help somebody recover. And we're looking at other famous stars who, and I don't need to mention another name right now, but who are not doing well with the medications that they're following. In this video, I'm going to share with you a discussion about a gentleman who's a patient of mine. He's after his first protocol. He's on his second protocol right now, and his age, let me just look that up and tell you. I'm not going to give you any of the personal information about this gentleman, but he's 63 years of age, and he came to my clinic in March of 2017 for Parkinson's condition, as well as some other symptoms, which I'll list out here, and I'm going to read off to you his protocol number 1, which gave him relief, and then his relief of certain symptoms, as well as his second protocol that he's currently following now. His second exam was done in June of 2017. Right now it's July of 2017 that I'm reporting this video to you, reporting this information to you. His initial symptoms when he came to me were his right arm has a less swing than his left arm. His constipation is occurring, or he's constipated, which may be occurring from medications. He's had anxiety, serious anxiety, for quite some time in his life. He has had a constant urge to pee. He feels that his right hand is stiff and tremors. His right leg is stiff and tremors. He's got poor balance, whether his eyes were open or closed. And he also mentioned that he feels like he's always drooling, even though he wasn't drooling. A drool down the side of his face, even though there wasn't drooling. Again, he felt as though his left shoulder blade was numb and itching for a big part of his day. He felt that his right lower lip was numb and tingling, and his right side of his tongue numb and tingling. He also had swelling in his right leg, and in his past he has had some dental work with crowns and root canals and mercury fillings in his mouth. He's been on diuretic and high blood pressure medication. He has had knee surgery. He's had anesthesia for colonoscopy. He's had anesthesia for the knee surgery. He had cataracts in his eyes. And again, the anxiety was a horrible situation in addition to all these other issues going on in his body. Again, as I mentioned earlier, his first protocol, very unique protocol, he started in, his exam was March 7th of 2017. He started that protocol shortly after, maybe about the second or third week in March, and I saw him again on June 8th of 2017. So after his first protocol, he told me that his anxiety that he dealt with for quite some time, the anxiety is at times totally gone. That's phenomenal, totally gone, as well as other times, if it does come back, when it does come back, it's 80% relief. So he has like a 20% anxiety episode compared to the horrible anxiety that he suffered before this first protocol. He also told me this, other improvements after his first protocol. His right bottom lip that was numb and tingling, the numbness, tingling, the sensation is normal. The numbness is completely gone. I did not treat his lip. I treated parts of the brain, which I'll get into in just a bit here. His right tongue that was numb, the numbness is completely gone. The sensation is in his tongue. He also said that he doesn't bite his lip anymore. He had a constant habit of like a tic kind of disorder of biting his lip, no more. He said now he's not stressed to hold his bladder. Again, I mentioned one of his first symptoms was the constant urge to pee. No longer does he feel that he's stressed holding his bladder. The drooling feeling on the side of the chin here is gone. The back, I said about the shoulder blade, the left shoulder blade, that he felt a back numbness on there, and as well as itchy feeling. He said that was a third of the day and or the evening. It could happen a big third of the 24-hour period. Now that's 100% gone. Although during the protocol, he did have to get retina surgery, which with anesthesia and with antibiotics, now his right leg swelling, he reports still the same. The blood pressure is still the same. I'm sure his swelling in the leg will go away with now this current protocol or a future protocol. The blood pressure will come down. I'm sure about that as well, because I've got you'll see another video I put up about a patient with Parkinson's who had blood pressure problems for 10 years. After his first protocol, his blood pressure is now in the normal range, and he's even getting into the lower end of normal, I should say, and he's considering getting off of that blood pressure med, because when you take away the causes of the disease, the symptoms disappear. That's it. Take away the causes, hidden causes that your neurologist and your cardiologist may not find, and it's not cholesterol with high blood pressure. When we can take away the hidden infections and toxins from your body, the body can calm down. And the third factor, in addition to infections and toxins, is electrical activity. Wi-Fi, cell phones, tablets, these are all causing damage to the body. There's a lot of proof about how these are causing congestion in blood vessels, causing cancers, causing leukemia, causing a number of different diseases in the tissues. So again, during the first protocol, between his first and second visit, he had surgery on his retina, and he did feel that his balance got a little bit more challenged after that procedure. You know, maybe the mercury got into his brain, maybe infection that's in the inner ear, maybe the anesthesia chemicals that they put into sleep or provided him. Any kind of procedure that was done in there during that procedure can actually have much more toxic effect to the brain and cause that balance symptom to get worse. Yet still, again, I'm going to repeat, anxiety gone, and other times 80% gone. His right lower lip that was numb, gone. The right tongue numbness, gone. He doesn't bite his lip anymore. The numbness and the itching on the left shoulder blade, gone. He's not stressed to hold his bladder anymore, as well as the drooling sensation on the side of the mouth. That's gone. So that is improvement. Even though his tremor is still there, that is improvement, because with the medications that he's taken, he never had the resolve of the anxiety, or at least partial resolve, almost complete resolve of anxiety. Never had control of the bladder. He didn't have control, or sensation in the lip, in the tongue, and the back itching, numbness. These are all symptoms of something going wrong in the brain. So it's not just the tremor. We've got to see, as we go through protocols and start peeling away the causes of the condition for the individual, that we see certain symptoms start to disappear. If somebody gets better after one round and one protocol with me, 10%, great. If they notice one symptom gone, but all the other symptoms, if they have 10 different symptoms, remain, that's just part of the healing process for the person. As we can take away what's causing the disease, we may take longer in one person to see the recovery. It may be shorter for another individual. But to start seeing other chronic symptoms peel away from the person's body relieved, then we know that we're on the right track, because the person is going towards getting better. If somebody has diabetes with their Parkinson's, and somebody has fluid retention in their legs, and they've got sleep apnea, and they've got anxiety, and they've got sleep disorders, and they've got digestive problems, and they could have high blood pressure, and they could have diarrhea and constipation. I mean some people who are loaded with symptoms, not just a tremor in the hand. Some people only have the tremor in the hand. Some people suffer chronic fatigue. Some people have a number of different symptoms that are going on, and we've got to handle them all. We've got to handle the connections to them all. So let's listen up here, and if you can't grasp everything I'm about to say in this video, in the first round, you have an easy way of just going back and starting the video over again and watching this information again that I'm going to share with you. And I'm not going to get into, I am going to share with you in great detail what's going on here in the first and second examination with this gentleman. But I'm not going to get into in certain infections. I'm going to keep it a bit more personal for him, because hopefully in the future, when he does really totally recover, he'll do a video with me to share with you that he's recovered and functioning well. And but some infections, I think, are just not anybody else's business. Okay, some things that I found. So I found with him The globus pallidus, if you're not aware about the brain and how the brain works, we have, which go to another video of mine, I've talked about how the brain works, about Parkinson's, but there are parts of the brain that have to control the tremor. One in particular is called the globus pallidus. The globus pallidus is a part of the nervous system that controls the too much excitement in the brain. This smooth movement of my muscle, smooth movement of my limb is equal excitation of the nerve and inhibition of that excitation of the nervous system. This, a jerky, interrupted movement, or the hand that just doesn't stop moving, or the arm doesn't stop going, or the leg, or the head, or the body doesn't stop moving, that's because the nervous system has too much excitement. Not that you're happy with that, that's not you're having a party excitement. I'm saying the nervous system is too wound up in certain parts, and the parts of the brain that calm that wind up down have become diseased. We've got to be able to have excitement to carry out a nerve potential and inhibition of that so it's a smooth, controlled nervous system function. Hopefully that makes sense. We don't want to have too much excitement. We need to have inhibition of that excitement so it's an equal, smooth move. Instead of too much excitement with no inhibition and we have some kind of abnormal movement, tremoring, okay? Or winding, or stiffness in the limbs when you're trying to walk and your arms don't move, or the head is jerking, or the mouth is moving. In this gentleman, I found in the globus pallidus, which is one of the controllers of the excitement of the nervous system that we need to have, its integrity needs to be restored so that you can control the tremor. Because these uncontrolled movements are caused by hidden infections and toxins in your tissues, in your brain, especially in the brain, in specific parts of the brain that are causing you to not function well. And sometimes, I'm going to repeat this, some people recover faster than others, but you can recover when we can clear up these infections and toxins, period. Because globus pallidus infected with scabies infection, streptococcus bacterial infection, anesthesia chemicals deranging the globus pallidus. The anesthesia chemicals don't just leave the body when you wake up out of a procedure and you feel better that day or the next day, or maybe a cloudy head went away a few days after the surgical procedure. The anesthesia chemicals, a lot of them stay in our body and get absorbed like a sponge into our tissues, especially when they affect the globus pallidus. The globus pallidus can't control the tremor. You have, he also had in his globus pallidus E. coli bacteria. He also had, there were a couple of other bacteria that I found there that sometimes people think are related to certain dental infections. I mean, there are other strep infections, staph infections in here that are connected to or inside the globus pallidus, were inside the globus pallidus, causing the globus pallidus a disease so that it can't control the smooth movement, can't inhibit too much nervous system excitement, in other words. Too much excitement, inhibition of the excitement, or stay in control where your arms don't move on their own or fingers don't move on their own. That's proper excitement and inhibition of the excitement. Hopefully that's making sense. I don't want to be too medical with you where you kind of lose the understanding here or not understand it or overwhelm you. But if you have a puppy dog that's so excited that you can't control no matter how many times you call its name and tell it to sit, and once you take out a leash and put the leash around the dog's neck, the dog sits and stays and listens to anything you say. The dog is a part of the brain, especially called the thalamus, that could be firing too high, and it's not under control unless you put the leash around it, around that dog, like the globus pallidus is the leash to get this nervous system to just say, all right, I'm going to pull the reins back on that system so we can control and we'd have a smooth movement. This globus pallidus also had MSG, neurotoxic. You know what that is, MSG, monosodium glutamate, neurotoxic substance inside his globus pallidus, parasitic amoebas inside his globus pallidus, a harmful food additive called EBTA damaging his globus pallidus. He also had a bacteria called treponema damaging his globus pallidus, malaria bacteria damaging his globus pallidus, DDT insecticide poison damaging his globus pallidus. He had a couple of different mold infections inside the globus pallidus, damaging his globus pallidus, not letting it control the other parts of the nervous system to have a smooth movement. So that's right there. 1, 2, 3, 4, 5, 6, 7, 8, 9. There were cephalexin antibiotic residues damaging the globus pallidus as well. Cephalexin or K-flex antibiotic damaging his globus pallidus. 9, 10, 11, 12, 13, 14 different infections and toxins damaging his globus pallidus that doctors he's been to couldn't find and don't look for and only prescribe a medication like an L-Dopa. or something like that. Find the cause. If you had, listen, make it very simple to understand. If you had a strep throat ever in your life, ever had a sore throat where you had an infection in the throat, you took a medicine to get rid of the inflammation and get rid of the infection, and then you could swallow again. So you could have the normal swallowing function. When you had the infection there, if you left it there and didn't get rid of that response, the inflammation, and didn't get rid of the bacteria in your throat, do you think you would ever swallow normally again? And the answer would be no. The infection would take over completely. You would not be able to have the normal swallowing function. So when the doctor evaluates you for your Parkinson's and doesn't look for these infections or toxins that could be causing deranged function, malfunction in your nervous system, Lyme disease, other things that will get in there, mercury getting into the globus pallidus. Any of these infections are causing you not to be able to put the leash on the dog to calm the dog down. Unless you can go through a very unique protocol, which I will do with you and for you, to be able to investigate your globus pallidus and find out what's in there. And it's not only the globus pallidus we have to check, but when we can investigate the tissue, find the hidden causes of disease in there, the hidden causes of the malfunction, that's the only way you're ever going to recover. The only way you have a hope, a chance to recover. I found in his, let's get to some other really important points here. In the brainstem also, we have a tissue called the reticular formation. And in the reticular formation, there's an area there where we have also, or right neighboring there, we have the substantia nigra. Substantia nigra is where we have the dopamine made. Well, inside that brainstem area near where that substantia nigra is, we have the reticular formation. Serotonin is made there. In part, dopamine comes from there or is integrated in there. Acetylcholine, many different neurochemistry, neurotransmitters are produced in this area and are shared with the rest of the brain. What would happen when you have infection in that tissue? Do you think you can make normal levels of dopamine, serotonin, acetylcholine, and other brain chemicals? Do you think you could when it's infected? If you can't swallow normally when you have a throat infection, how are you going to be able to produce your normal brain chemistries when that tissue is infected? It's not going to happen. His reticular formation, he also had strep infection in there. Also dental mercury in there. His cerebellum, in part controlling balance, in part regulating brain function, or introducing other signals to tell the brain what it needs to help regulate the body. The cerebellum helps to regulate limb function. There are different nuclei in the right and left cerebellum, different nerve control centers in the right and left cerebellum that tell your fingers how to move, that tell your elbow and your shoulder how to move, that tell your legs, your hips how to move. What would happen when an infection and or a toxin like a mercury filling from a tooth, from an insecticide, from a infection from the jawbone, from a gland where the saliva is made, which I found in his parotid gland. I found more bacteria, strep infection in that parotid gland that he had no symptom, and it goes through a blood vessel and it goes right into the cerebellum. What would happen when the nerve control center in that cerebellum that makes your fingers move, what would happen when that gets infected? Do you think you have normal movements, or are you going to be stiff and slow? Maybe you're not going to be able to control the movement. Maybe it's just moving on its own because something is in that part of the brain that's making it act in a very strange, hyperactive manner. Can a child be hyperactive? Can a child or an adult drink so much Coca-Cola or drink so much coffee where they become hyper? Yes. Can a person do a drug like a cocaine or an Adderall and become hyper? Yes. Can the brain, when it gets infected and toxic, cause that tissue to not control the limb? Yes. Can that limb become overactive and hyperactive? Yes. That is the key. Find these infections and toxins and get rid of them. So he had various bacteria inside his cerebellum and his mercury in the cerebellum, in part dealing with his balance. I did a very unique examination with him in the second round. Again, we're going to finish the first exam in just a minute, first protocol, which brought him all the relief with the lip and the tongue and the back and the anxiety and the biting the lip and the drooling, all that sensation and the urge to pee gone. But I did a very unique examination where I took several hundred hours of postgraduate study in functional neurology, and there is an area there are different nerve centers in the middle of the cerebellum, in the intermediate and the lateral parts of your cerebellum, the back of the brain here, that control fingers and control wrist and control elbows and shoulders and hips, that I gave him specific, unique, pinpointed, accurate, specific, great exercises, functional neurological exercises to do, very simple to do at home, to help start to really strengthen that part of the brain and wake it back up so it does what it's supposed to do by controlling the limb. Those are not the only tools that we need to use. Cleaning up the infection and toxin is the biggest point I got to make in here, is really, really super important. Those exercises can help as well, but using specific, safe and effective, pinpointed, excellent remedies that will remove these infections and toxins and start to repair the tissue that's been damaged from those infections and toxins is the key here. I found in a tissue that controls movements called the corpus striatum in his brain. I found he also had that strep bacteria in there. I found in the reproductive tissues when I did no probing, I didn't do any kind of invasive study. This is all the stress reflex bioresonance, no computer, no electrical device type of work that I do, examination. I found in his epididymis he also had strep, tuberculosis. I also found that in the arteries that go to his brainstem, the vertebral artery in the back of the neck and the basilar artery that goes to the brainstem, where the dopamine is made, these arteries were infected also with the strep bacteria. I found Streptococcus bacteria in his substantia nigra. I found Streptococcus bacteria in another movement control. Substantia nigra, excuse me, what I just said, substantia nigra is where your dopamine is made. What would happen when that tissue called the substantia nigra that makes dopamine, what happens when it's infected? Can that substantia nigra produce what it's supposed to do when something is diseasing it? What happens if the crops on a farm are infected with some kind of bug that eats up the corn? Let's say that a corn farm is riddled with different kinds of parasitic infection or bugs, whatever kind of bug, whatever, bacteria, parasite, whatever it is, that eat the corn. Are you going to be able to have the corn produced by that farm? The answer is less than normal, if any, is going to come out of that farm. So what happens, think of your substantia nigra as the farm that's going to make the corn, the dopamine. What happens when there's infection living inside that substantia nigra? What happens? What's going to happen is you're going to have less than normal dopamine made. What's going to happen to the rest of the brain that depends on that dopamine? It's not going to get it. Hopefully that makes sense. The basal ganglia that control smooth movements, he also had strep infection. He had infection inside when the arteries called the carotid arteries in the front of the neck go up to the brain to bring blood to 3/4 of the brain, where part of our motor control is dictated from the the frontal lobe of the brain, right brain, left body, movement, muscular control. The circle of Willis, this artery is called. I found strep infection and tuberculosis residues in his circle of Willis, candida in that circle of Willis. Remedies were produced to take those infections out of there. The circle of Willis is critical to be cleaned because a third of the brain, about 3/4, I'm making up a number generalizing, but 3/4 of the brain is fed blood by the blood that goes to the circle of Willis from the carotids. So what happens when there's congestion, infection, inflammation going on inside that circle of Willis, that brings blood to the majority of your brain? That part of the brain, or those parts of the brain, are not going to work well. He came back, he reported to me of all that relief, still the tremor, still the balance problem, but relief to parts of the body, relief to anxiety. Excellent, he was happy, ready to move into the next exam. In his next exam, I went and studied the whole brain again, and I found in his brain he had a massive amount of the treponema bacteria. I found more anesthesia chemicals in there that we're getting out of there. I found a parasite called Blastocystis hominis. I found aspartame, neurotoxic, fake sugar, sugar-free, sugar flavor without calorie, food additive called aspartame, a neurotoxic substance in his brain. I found Candida albicans and Candida krusei damaging the brain, inflaming the brain, robbing the brain of its normal function. I found a specific kind of mold in that part of in his brain. I found parasitic infection in his brain. I found a mercury additive called thimerosal. Thimerosal has been added to vaccines for decades in his brain, damaging the brain function. I found DDT insecticide damaging the brain, mycoplasma bacteria damaging his brain. Further, I went into his cerebellum deeper in this round, and I found anesthesia chemicals damaging his cerebellum, Lyme infection damaging his cerebellum. I went back to his globus pallidus, the leash for the puppy dog, to control that puppy dog. I found, or to control the thalamus, to control the smooth movements. Again, inhibition of the excitement. We need smooth, not jagged movements or uncontrolled movements. His globus pallidus, mercury dimethyl methyl chloride. I found Lyme infection in that globus pallidus. Remedies will take those out of there. We don't need antibiotics. We don't need heavy metal chelator pills or IVs. The method that I'm providing is pinpoint accuracy remedy that will remove these infections and toxins from those tissues and repair the tissue at the same time, repair it from the damage it suffered from the infection and toxin. I found in the substantia nigra this time, which I said last time, the bacteria there, I found in the substantia nigra. I found Lyme infection in the substantia nigra, robbing the substantia nigra's ability to produce normal levels of dopamine and control your movement smoothly. I found MSG in his substantia nigra. I found residues of tobramycin antibiotic in his substantia nigra. I found in a part of the brain called the hypothalamus, Lyme disease in the hypothalamus. That pretty much, without getting into really explicit detail about what I offered him in this protocol, that's the basis of a second protocol. That was June of 2017. I should see him in a couple of months after that, sometime in August or September. I see this gentleman again. The great thing about his first protocol, he had great relief. Again, I'm reporting again, the numbness in the lip, the drooling sensation, the numb tongue, the numb and itchy thing that aggravated, spot on his back that aggravated him for so long, the anxiety, the biting of the lip, the urge to pee, gone. Phenomenal. The more that we work together to peel away the infections and toxins and boost up the function with these specific awesome remedies that I'll make for him, my lab will make for him, from the findings that I discovered with my very unique work, we will see this man recover. And when he does, and he's happy to share that story with you online, we will be making a video. You can come into my clinic, any of you who are watching this, who really want to start to get your body under control and find out what is causing your body to not work well like it did 20, 30, 40 years ago. Now is the time. There's no reason to wait. If you want to wait for the miracle drug, the miracle injection, the miracle cure, that's your decision. But why wait when you could be more proactive at starting to remove the causes and see your body start to repair? And I'm happy to help you do that. My clinic is in South Florida right now, of July of 2017. I'm still here in South Florida in the US. I've got patients who come to my clinic from other parts of Florida, other states in the United States, Canada, Israel, New Zealand, Netherlands, Thailand, Venezuela has come here, Colombia, United Kingdom, Italy. I've had people come, Mexico, I've had people coming from other parts of the world to come to my clinic. Belgium, we've had from Africa coming here to my clinic for this very unique work. It can take longer in some patients than others to see recovery, but the recovery is possible. I shouldn't say that. And recovery is possible when you remove the chief causes that are making your individual body break down compared to another person. Everybody is unique, everybody's different, regardless if it's called Parkinson's and a million people are called Parkinson's. Everybody has their own separate, unique set of circumstances and will heal in their own pattern. I believe I can get the job done for you. This is not about a cure for Parkinson's. This is about finding what's causing your condition and removing those causes and boosting up the nervous system function. Like this video, if I shed any light on your body or helping you get well, like this video, share this with a friend. Very simple, just press the share button and send it out to a friend, just one friend. People deserve to know there's different information out there that can help them get well. Like me on my Facebook page, follow me on Instagram, and be the first to know when I put up new videos, because you'll get a link, you'll get sent an email when I put up a new video here. Call my clinic at 954-370-3100. Send an email to my assistant. She'll be happy to help you whichever way you call or send an email. I'll put both the phone number and the email address on the screen here, and contact. And we're usually on a 2 to 3 month waiting list here for the first appointment. Contact, she'll let you know what you got to do to get paperwork in here. Let me see labs, let me see MRIs, whatever it is that you've had done before, whatever procedures, whatever treatments, whatever it is. I want to see all that for our consultation. Be very detailed, very explicit, different than what you've gone through before with other physicians. And we're going to start picking apart what's causing your condition and start to see your body repair itself, okay? Further, just to cover this, insurance policies, whether it's Medicare, Medicaid, Social Security, disability, workers' comp, PPO insurance, HMO insurance, EPO policies. There are no policies, there are no insurance companies that are recommending the kind of work, or I should say recognizing. There are no insurance types of policies that recognize the kind of work I offer. That's just the way it is between your insurance company. I can't change that. What I can do is offer you an effective service to help you start to clean up your body and help you start to restore function to your tissues. And that's what I'm here to do. So your work with me is going to be something you have to invest in yourself and take care of your body. And that's just the way it is. So again, call my clinic at 954-370-3100. Send an email to my assistant, and we'll look forward to helping you and helping you get well and start to put you on the journey of your recovery.
In 1908, Shin Nippon Chiso built a factory in Minamata, a small fishing village in Kumamoto, Kyushu. The company manufactured nitrogenous fertilizers and soon became the major industry in Minamata. By the mid-1950s, Shin Nippon Chiso had become the industry leader in its field. In 1954, the Sanitation Office of Minamata City began receiving reports of an unknown epilepsy-like affliction which has since become known as Minamata disease. Since the cause of the disease had not been identified, patients were isolated to prevent spread of the disease. Minamata disease is a neurological condition. Mercury poisons the central nervous system, damages the sense of balance and motor skills, which leads to increasingly intense body convulsions and ultimately death. In 1957, the Minamata Disease Research Group of Kumamoto University announced that Minamata disease is a toxic disorder of the central nervous system caused by certain organic mercury compounds transmitted through the intake of seafood. They isolated organic mercury as the sole cause through a series of experiments on cats. In the same year, extremely toxic levels of organic mercury were detected in the human patients. The report submitted to the Ministry of Health and Welfare stated that the underlying cause was organic mercury in seafood, and the wastewater discharge from the factory was suspected. Afflicted patients continued to be found until 1960. A rash of babies were born with brain damage and extreme physical disabilities. The governor of Kumamoto requested a voluntary ban on catches of seafood from the bay.